The following segment sponsored by Gastroenterology Associates.
Well, this month, of course, is Colon Cancer Awareness Month, an important time to raise awareness of the second deadliest cancer in the United States. This morning, we're here at Gastroenterology Associates right here in Bristol to learn about important information on screenings that could save your life. All right, we are now taking you inside one of the actual procedure rooms here. We want to introduce our doctors we have this morning. We have Dr. Gary Ann Fish joining us along with Dr. Christian Sullivan. And we want to, first of all, thank you both so much for taking the time to talk with us about this. We continue, obviously, to see the numbers. I think with colon cancer, one of the silver linings is that the screening is so important because we can actually treat the cancer.
That's right, and thank you all for being here today to help us spread awareness about colon cancer. It is one of those cancers that is completely preventable, and the treatments for colon cancer are very effective. So it's something that if there's a way you can prevent it and never have it, that's a really good thing, and we want to spread awareness about that.
And obviously screening is really important, and one of the things we continue to hear about is that age change where now at 45 they're really recommending that first colonoscopy.
Yeah, so the American Cancer Society actually changed the screening age from 50 to 45, and we've seen in our practice, younger patients that have no symptoms at all and have had, increased number of polyps or even colon cancer.
Of course, we think about colonoscopies when we think about colon cancer, but there are other screenings that are out there as well.
Yes, that is true. So colonoscopy is still the gold standard for screening for colon cancer. It is the most sensitive, it's the most specific, and it's a way that also, if you find a polyp that's precancerous, it can be removed. So it's diagnostic and therapeutic, which means you can also provide some treatments through colonoscopy. Some people get a little nervous about being put to sleep or having an invasive procedure, so there are some other tests that might be appropriate for others to screen for colon cancer. I'll let Dr. Sullivan talk about those.
Yeah, there's a stool test that tests for blood. There's also the Cologuard test, which tests for actually DNA from the polyp, so it can detect a polyp, and then we use that to kind of convince patients to maybe get a colonoscopy, or if they have a strong family history, we can use Cologuard to finally get them on board to do the colonoscopy, because then if the Cologuard is positive, we still have to do the colonoscopy and take the polyp out, which is the reason why the Cologuard was positive in the first place.
When we're talking about colonoscopies, I think people still have that and they may be a little bit apprehensive, but once you actually have that colonoscopy, you get through that prep and you wake up and you think, man, I don't know why I was so nervous.
Yep, that's true, and that's what patients say all the time. The hardest part really is the preparation, but the colonoscopy itself is really the easiest part for the patient.
And of course, when you do that procedure, when you're kind of going through looking for those polyps, most of the time I understand you're able to treat them so by the time they wake up, if they had a little something, it's already gone.
Absolutely. So that's why the colonoscopy is the gold standard, because if we do see a polyp, we can take that polyp out at that time, and that's completely, takes care of the polyp and prevents it from turning into something like cancer. The other thing about those polyps is most of the time they're asymptomatic. You don't know they're there, and you don't know they're growing there. They are slow growing. They take 10 to 15 years to turn into something like cancer. So that's why it's so important to take them out, because you just don't know that they are there.
As gastroenterologists, we do receive special training in colonoscopies, and we have a lot of education in digestive diseases. So studies have found that having your colonoscopy performed by a gastroenterologist does lead to higher detection of colon polyps, just because we have the specialized training and it's what we're doing all the time. And also, gastroenterologists are found to have lower perforation risk than some other doctors that might perform colonoscopy.
Dr. Sullivan and Dr. Fish, thank you so much for joining us. Certainly some important information. As we said, Gastroenterology Associates offices in Bristol and in Kingsport. For more information and location and phone numbers, you can always go to their website. That is gastrotn.com.
The preceding segment sponsored by Gastroenterology Associates.